the NHIF Acts could not accommodate the rollout of universal health care. And therefore, we passed the 4 laws that will support, which was the legal framework that will support the rollout of the universal health care coverage. And therefore, we had to come up with a clear roadmap of now moving from the NHIF to the Social Health Authority. The key thing also that we looked at is we have now 3 funds as opposed to the earlier NHIF where there was only 1 fund, which was the contributory fund. But now, under Social Health Authority, we have 3 funds. That's the Primary Healthcare Fund, which will cater for treatment of patients at level 2 and level 3 facilities. And this will be provided free to those who are registered under SHA. And then the second fund is the Social Health Insurance Fund, which is a contributory fund for all Kenyans who have registered and have either they are salaried or they are unemployed. If they are unemployed, then they have to be verified through what's called the means testing or assessment of their income based on their status, and they will be the assessment will be done, and they will know exactly how much they are supposed to pay in terms of their contributions, which will be 2.75%. Those who are salaried will definitely, from this month, the employers are going to deduct their 2.75% from their gross salary to be paid to SHA on the 9th of November. So the shift is basically because we have 3 funds. I have talked about the 2 funds. The other fund is the Emergency, Chronic and Critical Illness Fund, which will be funded through the Exchequer. So you realize that under this new funding model, we have 2 funds that are catered for by the national government. That is the Primary Healthcare Fund and the Emergency, Chronic and Critical Illness Fund that is appropriated and budgeted for through the National Assembly. But this middle fund, which is Social Health Insurance Fund, is what is member contribution. So there is definitely need to shift from the NHIF to the Social Health Authority.